Cigarette smoke is a chemical assault on your body. Every time you inhale, you're pulling in over 5,000 different chemical compounds, many of them toxic, carcinogenic, or both. Your body wasn't designed to handle this. What happens next is damage. Immediate, measurable, cumulative damage to nearly every organ system: your lungs, your heart, your blood vessels, your brain, your DNA itself. Smoking is one of the most thoroughly studied health risks in human history. We know exactly what it does, how it does it, and what the consequences are. But here's what's equally remarkable. Your body can recover. Not completely, not always, but to a surprising degree. Stop smoking, and within minutes your body begins repairing itself. Within years, many smoking-related risks drop dramatically. So let's explore what actually happens inside your body when you smoke, and what happens when you stop. The moment smoke enters your mouth, damage begins. Tar, a sticky residue containing hundreds of toxic chemicals, immediately coats your teeth and gums. This isn't just cosmetic. Tar promotes tooth decay, gum disease, and oral infections. Smoke damages the nerve endings in your nose and mouth that detect smell and taste. These sensory neurons are directly exposed to the toxic chemicals and gradually lose function. Long-term smokers often have significantly diminished sense of smell and taste. The heat and chemicals in smoke also irritate and inflame the tissues lining your mouth and throat, increasing risk of oral and throat cancers. Your airways are lined with cilia, tiny hair-like structures that constantly sweep mucus and trapped particles up and out of your lungs. This is your respiratory system's cleaning mechanism. Smoke paralyzes and eventually destroys cilia. Without functioning cilia, mucus and particles accumulate in your airways. This is why smokers develop chronic cough. Your body's trying to expel what your damaged cilia can no longer clear. Smoke penetrates deep into your lungs, reaching the alveoli, the tiny air sacs where oxygen enters your blood and carbon dioxide leaves. Chemicals in smoke damage the delicate alveolar walls, reducing their elasticity and eventually destroying them entirely. This is how chronic obstructive pulmonary disease, or COPD, develops. Your lungs lose the ability to efficiently exchange gases. You become chronically short of breath because your lungs can't deliver enough oxygen or expel enough carbon dioxide. Making this worse, cigarette smoke contains carbon monoxide. Carbon monoxide binds to hemoglobin in your red blood cells much more strongly than oxygen does. This means less oxygen gets transported to your tissues. The combination of damaged lung tissue and carbon monoxide creates the chronic breathlessness that characterizes heavy smoking. Nicotine is the primary addictive component of cigarettes. When you inhale smoke, nicotine reaches your brain within about 10 seconds. This is faster than most intravenous drugs. Once in your brain, nicotine binds to receptors normally activated by acetylcholine, a neurotransmitter. This triggers the release of dopamine, the brain's primary reward chemical, and endorphins, which produce feelings of pleasure and reduce stress. This is the neurological basis of addiction. Nicotine creates a powerful, immediate reward. Your brain learns that smoking equals pleasure and relief. Over time, your brain adapts by reducing its baseline dopamine production and increasing nicotine receptors. Now you need nicotine just to feel normal. Without it, you experience withdrawal, anxiety, difficulty concentrating, intense cravings. This is your brain demanding the chemical it has become dependent on. This addiction mechanism is why smoking is so difficult to quit despite everyone knowing the health consequences. Your brain has been chemically altered to require nicotine. Smoking devastates your cardiovascular system through multiple mechanisms. First, chemicals in smoke cause your blood vessels to constrict. This immediately increases blood pressure and makes your heart work harder to pump blood through narrowed vessels. Second, smoke damages the endothelium, the thin layer of cells lining your blood vessels. A healthy endothelium is smooth and produces chemicals that keep blood flowing freely. Damaged endothelium becomes rough and dysfunctional. Third, smoking makes your blood stickier by activating platelets, the cell fragments responsible for clotting. Normally, platelets only become sticky when you're bleeding. In smokers, platelets are chronically activated. The combination is deadly. Narrowed blood vessels with damaged walls and sticky blood creates the perfect conditions for clots to form. When a clot breaks a coronary artery, you have a heart attack. When it breaks a brain artery, you have a stroke. Smoking also accelerates atherosclerosis, the buildup of fatty plaques in artery walls. These plaques narrow arteries further and can rupture, triggering massive clots. This is why smokers have 2 to 4 times the risk of heart disease and stroke compared to non-smokers. Cigarette smoke contains numerous known carcinogens: arsenic, benzene, formaldehyde, nickel, chromium. These aren't trace contaminants. They're present in significant quantities in every cigarette. These chemicals damage DNA directly. They cause mutations in the genetic code of your cells. Most of the time, cells with damaged DNA either repair themselves or self-destruct. But sometimes, mutations disable these protective mechanisms. When a cell loses the ability to repair DNA damage and also loses the ability to trigger its own death, it becomes cancerous. It divides uncontrollably, accumulating more mutations, eventually forming a tumor. Smoking is particularly associated with lung cancer, but it increases risk for many cancer types: mouth, throat, esophagus, stomach, pancreas, kidney, bladder, and others. Smoking accounts for about 30% of all cancer deaths in the United States. It's the single largest preventable cause of cancer. The dose-response relationship is clear. More cigarettes per day and more years of smoking both increase cancer risk. But there's no safe level. Even light smoking increases risk. Beyond the major systems already discussed, smoking affects nearly every part of your body. Your immune system becomes less effective. Smokers get sick more often and take longer to recover. Your skin ages faster. Reduced blood flow and chemical exposure break down collagen and elastin, creating wrinkles. Fertility decreases in both men and women. Smoking damages reproductive cells and hormonal function. Bone density decreases, increasing fracture risk. Wound healing slows due to reduced blood flow and impaired immune function. There's essentially no part of your body that remains unaffected by smoking. The remarkable thing about the human body is its capacity for repair. Stop smoking, and recovery begins almost immediately. Within 20 minutes of your last cigarette, your heart rate and blood pressure start returning to normal levels. Within 12 hours, carbon monoxide levels in your blood drop to normal. Your blood can carry oxygen properly again. Your risk of heart attack begins decreasing. Within 2 days to 3 weeks, your circulation improves. Blood flow to your extremities increases. Walking becomes easier. Within 1 to 9 months, cilia in your lungs begins regenerating. Your lungs can clean themselves again. Coughing and shortness of breath decrease. Lung function measurably improves. Your senses of smell and taste, damaged by smoke, recover during this time. Food tastes better. After 1 year, your risk of coronary heart disease drops to about half that of a continuing smoker. After 5 years, your stroke risk can fall to that of a non-smoker. After 10 years, your lung cancer risk drops to about half that of a continuing smoker. After 15 years, your risk of coronary heart disease is similar to that of someone who never smoked. These aren't guarantees. Damage done can't always be fully reversed, but the risk reduction is real and substantial. The message is clear. Quitting at any age provides benefits. It's never too late for your body to start recovering. Knowing you should quit and actually quitting are very different things. Nicotine addiction is powerful, and withdrawal is genuinely difficult. Common withdrawal symptoms include intense cravings, irritability, anxiety, difficulty concentrating, increased appetite, and depression. These symptoms peak in the first few days and gradually decrease over weeks to months. Fortunately, effective tools exist. Nicotine replacement therapy provides nicotine without the toxic chemicals in smoke. This addresses the physical addiction, while you work on the behavioral aspects. Prescription medications, like varenicline or bupropion, can reduce cravings and withdrawal symptoms. Counseling and support groups provide strategies for managing triggers and maintaining motivation. Exercise helps. Physical activity reduces cravings, improves mood, and provides a healthy alternative coping mechanism. The most important factor is typically multiple attempts. Most people who successfully quit have tried several times before. Each attempt teaches you more about your triggers and effective strategies. Smoking is a voluntary exposure to thousands of toxic chemicals with no physiological benefit and enormous health costs. The damage is extensive, affecting nearly every organ system. But your body wants to heal. Stop smoking, and recovery begins immediately. The degree of recovery depends on how long and how much you smoked, but the direction is always positive. If you smoke, quitting is the single most impactful health decision you can make. If you don't smoke, the evidence for never starting is overwhelming. Your body is remarkably resilient, but it's not indestructible. Smoking tests those limits in ways nothing else does.